our Ovarian Cancer Experience Registry and Sisterly Advice Workshop. My name is Kelly Kraft. I am a program manager at Gilda's Club Quad Cities, and I'm here with Jodie Kavensky, founder and CEO of NormaLeah Ovarian Cancer Institute or Initiative. And today we'll be talking about ovarian cancer and our Ovarian Cancer Experience Registry. And so first off, I'm gonna let Jodie take it away, introduce herself and talk about NormaLeah, and then let her talk about ovarian cancer for a bit, and then I will come back and talk about the registry. So Jodie, take it away.
Okay. Hi, I am Jodie Kavensky, and I am the founder and CEO of NormaLeah Ovarian Cancer Initiative. It's Awareness Month here, our National Awareness Month, so it's really exciting to do a program now. I want to thank Kelly Kraft for organizing everything. So, I started NormaLeah about 12 years ago because it was about 6 months before my mother passed away. And she went to a cancer luncheon and they only talked about breast cancer. They didn't talk about ovarian cancer. And she had been struggling with this disease for 7 years and was beside herself about it. She was really enraged and she begged me to please become the voice for all those who've been silenced by this disease. In a way, she was challenging me because she knew I had a background in healthcare marketing and non-profit organizations. So my first job was as a candy striper as a volunteer, and this is my last job as a volunteer. I do all of this as a volunteer, which is nice, and I can't find where my slide, there we go. So normally I named it after two sisters. Norma was my mom and Leah was her sister because sisters share a lot of things, and cancer, especially ovarian, should never be any of them. Both of them died of ovarian cancer. Norma was my mom, Leah was her sister. My Aunt Leah died in 1998 at the age of 67. My mother started worrying about things, and so she did get in touch with her doctor, who had performed a radical hysterectomy on her when she was in her early 20s because she had some issues with childbearing, and kind of told her that she really wasn't in much danger and not to worry about it. However, in 2001, 3 years after her sister died from ovarian cancer, my mother was diagnosed with stage 3C advanced ovarian cancer. She struggled with it for 7 years. She had 3 different surgeries, 6 separate rounds of chemotherapy, and she rarely complained. So this is why I knew that she was so upset. I was her caregiver, primary caregiver for the last 3 years of her life. And this is really the presentation that if she was here, she would give you the sisterly advice, both her and Leah. Community-based program, like I mentioned earlier, it does cover a little bit more of ovarian cancer and a little bit less of genetics, but since this talk is about genetics and genetics is our future, it's really interesting. I listened to a podcast from the James Cancer Center at my alma mater, Ohio State University, and it was all about cancer and genetics. So we are on the cutting edge of what is going on there. And I'm going to just spend a little bit of time on the symptoms before we talk about risk. So really what you need to know is know the symptoms, know your body, and know your daily habits so you can protect your growth parts, which is one of our projects that we do here a lot, is our Grow Parts project. I know many of you have seen these, many of you passed hundreds of them out. I'm not going to spend a lot of time on the symptoms. For those of you who aren't familiar with it, these are the symptoms. The back of the card has a piece of tape so it can go onto a mirror. Some of the other symptoms that we usually tell people to watch out for are, there's a plethora of vague symptoms that you just can't figure out exactly what's wrong, but inside your body something wrong. And I know that all the survivors here are probably shaking their head right now about that. This is my favorite slide of the whole presentation because it is part of my personal story. But with my mother at Easter, she was eating Tums like they were jelly beans. By the time we got to Christmas, she was insisting that we go to the store after dinner because she had such bad gas. She needed some gas X. It was another 11 months before she was actually diagnosed with ovarian cancer. So just in summary, as far as the symptoms are concerned, you know, they mimic conditions, advance slowly. Usually it's more than one symptom that I showed you, that if they are in two of them or more and they're persistent for 14 days, call your doctor before it becomes acute. Most ovarian cancer is not caught until it is acute, which means that your symptoms have gotten out of hand because it is a later stage in the disease. And believe it or not, 30% are diagnosed because of an emergency room visit. So not only is that the most important thing about ovarian cancer that women need to know, but also you can still get ovarian cancer even if your ovaries are removed. My mother did, Norma did. So that's important for women to know. And another important fact, it's really a misunderstood fact, is the Pap smear does not screen for ovarian cancer. It can detect it if it has developed enough that it has moved into the cervical area, but it is not looking for it. And so that's why it's really important to know not only the symptoms, but also your own personal health history. And I'm not going to read this list. You could go back to it anytime. If anybody would like me to send you a copy of the slide, you just let me know. But these can put a woman at higher risk, as well as genetic. It's not on here because we're going to talk about that in depth. And I guess the saddest thing about ovarian cancer is that there is no screening test, but there are early detection tests. We're not covering them again today, but I'm happy to give you that information after this session. And as many of you are well aware, the best thing to do is get a referral to a gynecologic oncologist, because they are specialists in this disease. And I listened to the podcast today, and you know, even at Ohio State, they have all these clinical trials. They actually, this doctor who I met at a national cancer conference said that no matter who walks in those doors, no matter what stage of this disease you're at, there is at least, I couldn't believe he said this, there is at least one clinical trial that they are working on that they could enroll you in, which to me was so much hope. So I want to turn the attention to the genetics. You know, I just love this slide because she really is a very beautiful woman, but she's the one who blew the lid off genetics, and especially genetic inheritance, and the importance of knowing your family cancer history, because family cancer history, especially breast and ovarian, are one of the biggest risk factors. And what the medical has done is they've come up with a name for it called, we say HBOC, but it's hereditary breast and ovarian cancer syndrome. And it is mostly when you inherit either a BRCA1 or BRCA2 gene. I've done a lot of studying on this because I am a carrier of the BRCA2 gene. My mother, Norma, had it. I also have it. I consider it an asset in my line of business, just because I am anxious to learn more about it. And these two BRCA genes, everybody inherits a BRCA1, and I should call it BRCA, which somewhat stands for breast cancer, and some say it stands for Berkeley, California. But I did meet the woman who was one of the discoverers of it, and I called it a BRCA gene, and she yelled at me. So I try as much as I can to call it the BRCA gene, because that seems to be a little bit more along the lines of what she needs. But it really can increase a woman's risk of ovarian cancer. And depending on the mutation, like I said, there are thousands of them. It can increase a woman's risk of breast cancer up to 80% and ovarian up to 40%. In fact, it plays a role in many cancers. Up to 10% of breast cancer diagnoses are linked to a BRCA gene, and up to 20% of ovarian cancer. So that's a pretty good percentage of our survivors who should know what their genetic makeup is. But it not just in those two, it doesn't play a role just in those two. All of these are linked through the BRCA mutation. And it can be inherited by men who are going to be at higher risk for prostate, melanoma, pancreatic, obviously not endometrial or ovarian. But there are thousands of other genetic mutations that are inherited that can play a role in the development of ovarian cancer and many other cancers. I have TP53 highlighted down at the bottom of the screen because TP53 is been found to be in 50% of all cancers. And this is why genetic testing is so important. However, when it comes to ovarian cancer, it's in 70% of ovarian cancers. Lynch syndrome up at the top is linked to colon cancer as well. Most cancers do have a genetic component to them. However, that does not mean that you will be developing ovarian cancer. It just means that you're at higher risk, and there are so many more that they haven't identified. So how do you look at your genetic inheritance? Let's look at my family. So this is Norma and Leah's parents on the left side of the table. I've circled them. And if we look at the descendants, I'm trying to think, this picture was probably taken about 70 years ago, 70, 80 years ago. The descendants, there are probably 20 descendants who have been diagnosed with breast, ovarian, or that I personally know of, or pancreatic cancer. So why my family history is so pertinent is because Norma and Leah's parents, Abe and Helen, were first cousins. However, in the 1920s, they did not know about consanguinity and how when you bring genetics together, and it will increase the likelihood of a mutation occurring and being passed along to the next generation. So there is a smaller gene pool and a much more homogeneous one. And our family is Ashkenazi Jews, which just because we're Ashkenazi Jews, puts us at a much higher rate, 10 times more likely to develop ovarian cancer, to carry a BRCA mutation than the general population. And most of the Ashkenazi Jews come from an area in Eastern Europe. They do have Eastern European heritage. I'd like to caution the people I speak to about being Jewish and being from Eastern Europe, the Eastern European region, because during the pogroms in the late 1800s, during World War I, and especially during World War II, the Jews were being persecuted in these countries, and many of them fled their home countries. In order for them to flee, they had to declare a religion. So many of them declared no religion or not Jewish, because if they were declared Jewish, if they had declared themselves as, they might not have been able to leave. When they resettled wherever they went, many of them did not pick up that religion and are not practicing it. So you could be of Eastern European heritage. There could be some Jewish blood in your background. So when you look into your family history, check to see who's from these countries in Eastern Europe. And let's talk about how you inherit it and genetic inheritance. So you can inherit, we inherit half our genes from our mother, half of them from our father. So it could be on either side of the family. And typically we see that men with breast cancer have a higher percentage of BRCA related mutations than others. So if we all go back to 7th grade biology and we remember Gregor Mendel, we have come so far since, well, when I was in 7th grade, and I think most of you are somewhere in the same generation as me, but we have come so far. And so I want to just review about what we do know now about our genetic makeup and why it's so important if someone in your family or you yourself has been diagnosed with cancer, whether it's ovarian or any cancer, to know what your genetic makeup is. Because genes make up part of our DNA. Believe it or not, we've got 20,000 different genes in our body. And all these genes have many variants. So the gene for our eye color, we've got blue, we've got brown, we inherit it from the parents. You could take it from there when you use Gregor Mendel's chart. But they pass down through the generations. And sometimes as they're passed down, they can mutate and make a gene function improperly. So in the past 10 years, there's been explosive growth when it comes to genetic testing. And it is now a recommendation that all patients diagnosed with cancer, no matter what kind, be encouraged to do genetic testing. Because not just for identifying these genetic disorders like HBOC or Lynch syndrome, but also to identify proteins that might be working or not working within each gene, and that can help drive treatment decisions. So these mutations are common in many, many, many cancers. Sometimes they're germline mutations, which means they were inherited from a parent. But sometimes in a tumor, they're also somatic mutations, which means they developed over time due to the environment or due to something else in the system going a little wacky, and our body is not immune to all these things and doesn't know how to fight off, and it's just a glitch. And there's not a whole lot we can do about it. But the somatic will occur in single body as opposed to genetic or germline, which is in every single cell in our body. So how do we know all this? Well, because we have data, it's called genomes. So in 2003, the Human Genome Project was completed. I don't know how long it took, but it identifies all the DNA molecules and genes that make up our body. It is our genetic code. And if we could read what's in our body, scientists can read what's in our body, then they have a new understanding of how we could be treated. And there are just so many advances in medicine that have been tied to the genome. And it's not just in cancer, it's also in many other diseases. And what this information is doing is it's actually, it's doing molecular profiling, which identifies biomarkers within our molecules. And that enables doctors and medical professionals to practice precision medicine for not only the person who has the cancer, but also because you know the family history for the offspring, the siblings, and also when you do have if you are diagnosed with cancer, they can utilize targeted therapies. And there are new targeted therapies coming out every day, because what they've been able to do is identify the mechanisms that allow uncontrollable diseases to ravage our body. And if somebody in your family does have ovarian cancer or another cancer, the best thing that can be done is to look at risk reduction strategies. Because you can reduce your risk if you are at high risk. And I love, this is another one of my favorite slides because I call it the gift that keeps on giving. This is my daughter Elise. She is also BRCA2 positive. She inherited my mutation. And unfortunately, she found out the same day that I picked up her medical diploma from her university. She had been tested there. She just had her second gynecologic oncologist appointment this week so that she could stay on top of her health. But this is where science and medicine are so exciting and they come together. Because it really is important to know what's in your makeup. And I really do believe in this. I'm going to tell you another story, which most of you know. My husband passed away last year. He was diagnosed with stage 4 lung cancer. He has all kinds of cancer in his family. His sister had kidney cancer. His mother has had breast cancer several times. And what I did, before he left the hospital, I had vials of his blood drawn and banked for 50 years. So that as this field of genetics and genomics explodes, we can go back and look at his blood and they say, okay, well, did he have this? Did he have that? Whatever he had, because he did have genetic testing, they can go back and look for new variants. Now, he didn't have any variants. He didn't have any goofy proteins that were missing. I know PD-L1 is a really big one, which enables the immunotherapy drugs right now. But that's why genetic testing, I wholeheartedly believe in it. And there's a lot of different things that need to be considered when we're talking about genetic testing. And I always suggest to ask your medical provider about it. They can send you to a genetic counselor. Now, in the Quad Cities, we do have 2 genetic counselors, one affiliated with each hospital system. If you would like to get more information on that, I can get you that information. However, there are not enough genetic counselors to go around. So many doctors are now providing the counseling to their patients before they do the blood draw. There are also direct-to-consumer tests, and in science, I don't say what any of them are. Some of them are looking more at heritage than they are at tumor profile. But the main one that is looking for the BRCA mutations, if I had purchased that and I had taken it, it would have told me that I didn't have a BRCA mutation because it only looks for the 3 founder genes, the 3 most common genes. And that's why we urge women to talk to your medical provider. They are getting so far advanced now in these genetic testing area that now there's a spit test. They can do saliva right in the comfort of your home. You don't have to have a blood draw, but usually it is a blood draw. The other thing that you need to remember is that knowledge is power, but is that power going to benefit you or is it going to be a burden? And I guess it depends on how you look at it. To me, it's a benefit. I can make sure that my daughters are tested and checked and I can take care of myself, because even before I knew that I had the BRCA mutation, I had active surveillance every year with my annual exam. But the other thing we have to worry about is a few insurance considerations. So one of them is the Affordable Care Act. And right now, as the Affordable Care Act stands, I'm so excited to be able to have said this now for almost 4 whole years. Any person with a first-degree relative who had breast or ovarian cancer is eligible for BRCA testing, and their insurance must pay for it if they meet certain criteria. This is the criteria, and I kind of have this memorized. If the person who was impacted by the disease is no longer alive and was never tested, then the next of kin and the siblings automatically can be tested. This is called cascade testing. If the person who was diagnosed with cancer has been tested and tested negative, then there's no way that person passed on a positive gene. That doesn't mean that it can't be somatic sometime in the future, but it would not be a germline mutation. Now, if they have tested positive for a BRCA mutation, then insurance must also pay for the sibling or the next of kin to be tested. So the Affordable Care Act is one consideration. The other consideration is called the GINA, Genetic Information Non-Discrimination Act. And basically what that says is that you cannot be discriminated against by health insurance or employment because you have a genetic mutation. However, you can be discriminated against with health insurance, or with life insurance, I'm sorry. So we do encourage women who are not survivors and are going to find out so that they can be proactive about their health, to buy their life insurance before they get tested. And the new recommendation now is that all women diagnosed, actually all patients diagnosed with cancer, should get genetic testing and tumor profiling, so that the doctors can really drive the treatments of your disease. That's what I have to say today about breast and ovarian cancer and the genetic inheritance of it. I know that this is the sisterly advice that Norma and Leah would have shared with you if they were still here. This is probably the last known picture of them taken. And we are more than halfway through Ovarian Cancer Month, but we're a lead into Breast Cancer Month. Our color is teal, breast cancer is pink. And so we like to say, think pink and feel teal all month. I'm now going to pop it back to Kelly, who is going to tell you how to expand your circle of support. So I will pop you back here now.
All right, thank you, Jodie. That was awesome. And I am going to make myself spotlight now. And I'm here to talk about the Cancer Experience Registry. So let me get my PowerPoint started up here. All right, so the Cancer Experience Registry is a really cool thing that the cancer support community, kind of our headquarters, our nationwide affiliate network, put together. And it's pulling together of surveys that asks about a range of different topics about cancer. So it's to get, the whole idea of it is to get the patient experience from the people who know it most, the patients, the survivors, and the caregivers. They're the people that we need to hear from, that policymakers need to hear from. And so this is a really cool survey that just really gets to the heart of the cancer experience. So it talks about the physical things that people dealing with cancer go through, but it also talks about the emotional things and social issues for both people impacted by cancer, people diagnosed with cancer, and the caregivers. It really gives a voice to the individual and the collective experience. So what these things do, what this information does, is it helps us develop our program and know what information people need and what things you guys are dealing with, so that we can make our program even better. And beyond that, this information gets used for policy change. So being brought to lawmakers, these are numbers and stories that we can give them to show what policies need to be changed. And it's open to anyone impacted by cancer and their caregivers. So there are a bunch of different versions of this, and it's completely confidential. So we already have over 14,000 patients and caregivers registered for the Cancer Experience Registry. And there's kind of some questions that everyone gets asked, some general cancer questions, but then there are diagnosis-specific questions. So today we're talking about ovarian cancer, but a lot of the big cancer types have their own registry with some specific questions aimed at people impacted by that kind of cancer. So somebody with a stomach cancer diagnosis may have different questions than someone with a multiple myeloma diagnosis, so that we can really get down to what those people are going through. And it covers all kinds of things. So it gets kind of that basic information, that demographic information, talks about your cancer type, treatment history, and then talks about the social and emotional pieces, the pieces that a lot of times don't get talked about, and that policymakers aren't hearing about, and the things that we need to remind them are important. So distress, quality of life, treatment decision-making, and how how we go about that, and how sometimes making those treatment decisions can be difficult, and how we go about making those decisions. What side effects people are experiencing and how do they manage those symptoms. Talks about clinical trials, financial toxicity. I think that's so important. It's one of the things that doesn't get talked about a whole lot when it comes to cancer, is how much it can hit the bank account. And that's something that, again, especially with insurance coverage and how much that's changing, we need to be telling our policymakers and our the people who can make and change the laws what we're going through when it comes to how our cancer treatment, and not just the treatment costs, but losing, you know, maybe missing work and losing insurance because of work, all those other things that come into play when it comes to finances and cancer. Your support services, and then it asks some work-related experiences and policy-related topics. So it really gets into the things that are important that aren't just the physical, of course the physical, but trying to get the whole experience and the whole person in the picture. And these are some of the concerns that we've seen with the Experience Registry so far. So eating and nutrition. A lot of people who are impacted by cancer are interested and want to know more about eating and nutrition. That's a top concern for them. And then that exercising and being physically active. And like Gilda's Club Quad Cities, we've been doing a lot of workshops that stem back to eating and nutrition and helping people stay physically active. Our yoga and our chair yoga, things like that. Because of stuff like this, we wouldn't know to do it if it weren't for things like this. And then worrying about the future and what lies ahead and things like that. Those are the things that we talk about in our support groups, and making sure that people are, you know, talking together about these things that are hard. And then we get down to health insurance and money worries. And those are things that we talk about in support groups. Those are the things that our social workers can give resources about. And so knowing that these are the things that are bothering people and things that people need more information, resources about, it helps us make our program better, and it helps us be able to affect positive change to benefit people impacted by cancer. So the data that's taken from this is presented at national and international conferences. So it's confidential, but the information gained from it really reaches far and wide. And it's used to support initiatives in Washington, D.C., which I think is one of the biggest things about it. And it's shared with medical professionals, so doctors get to see these this data so that they know what their patients are going through, because they only see one side of it a lot of the time. They see you for you know, a few minutes here and there every time you're getting a treatment or what have you, but they don't get to see what you're dealing with at home. And so this gives them some of that information. And again, it helps us know what we need to do. And not just Gilda's Club Quad Cities, of course, Gilda's Club Quad Cities, but it also tells nationwide what we need to focus on and what you guys need. And it's really, it's a great survey. It's very confidential. When you go into it, which we'll go through kind of the steps, you agree to confidentiality and all the terms and things like that. But because it's a survey, they're able to keep it pretty confidential. The information gets shared out, but your name and your contact information aren't put with that. The only people who can really see your name put with it are some very specific researchers for cancer support community. And so here's the link for how to join. It's kind of our specific little link, and you can just click on that. I'll have it in, everybody who's attending via Zoom tonight will get it in an email, and it is also in the description for the Facebook event as well. So if you're watching this live or watching it later, you can just click that link and go right into it. And it's pretty easy. It's a lot like signing up for any website, you know, when you get a Facebook account or an email account or whatever it is, you always have to log in and make your password. So it's really not that big of a deal. You click the join button, and then these are the 3 steps. You agree to informed consent, put in your email and your primary diagnosis. Most people for this workshop will put ovarian cancer or caregiver status, and then you complete your profile. And so you'll see the informed consent, it is a survey. So they want to make sure that you know what you're getting yourself into, that you're okay with giving this information. And then you put in the stuff that you expect to put in, your email, password, and diagnosis information. So that's a really quick step. And then you have to verify your email, just like in everything else you sign up for. They send you an email and you have to verify. Click the link, pretty easy. And then you complete the profile. So once you do that, you're able to go in and then start that experience registry. It's really pretty user-friendly. Takes a little bit of time, but it's so worth it. And I'd also like to make it, put a little plug out there. If anyone, it's September 17th, 2020 right now. If anybody finishes it tonight by 11:59 tonight and emails me, and my email is in the description for the video. Email me tonight and let me know that you completed it, because I don't see live who completed it. We'll enter you in for a $25 Texas Roadhouse gift certificate for a drawing for one of those. So that'll be fun. So I don't see any questions in on Facebook. I'm just checking to make sure we don't have any questions. It doesn't look like it. So I'm about to end the Facebook Live portion of this, but I want to thank Cancer Support Community for making this possible, and thank Jodie and NormaLeah for bringing their expertise and care to this workshop. And I hope that everyone got something great out of this, and that you all sign up for the Cancer Experience Registry. Thanks so much.